What is pain? And does pain mean tissue damage? This is what we're going to discuss in today's video. Welcome to the PhysioBrake channel. Please like, comment, and subscribe with notifications on for more content. Now, when we're looking at pain, people automatically think to themselves, oh no, I have pain, that means I must be damaging something, which can be true. However, it's not always the case. There's two main types of pain. We have acute pain, pain with before and during an initial injury, and chronic pain, betterly known as persistent pain. Now, persistent pain doesn't always line up with pain equaling tissue damage, but we'll come more into that. So we're going to focus on acute pain, just to begin the talk here. So what is the role of pain with acute pain? Well, pain is actually an output of the brain, warning us that, hey, if you go any further and put any more force through this tissue, there's going to be damage that occurs. So it's actually an alarm system letting us know that injury will happen. So if you're, for example, if you're playing basketball and you're going up for a layup and you come down on a twisted ankle, that moment right before the ligaments start to have a bit of strain and tearing, pain signals begin. And then initially afterwards, you also have an increased pain response that's telling you the body to be like, hey, let's not move this anymore. We just need to relax and not risk any further injury. But this isn't always the case. We can see that there's lots of incidents of people not even realizing they're hurt in dire situations and still performing. So this kind of shows that even if you have a broken arm, but you don't even know that you have a broken arm and you can still complete the task in a life-given situation, that pain doesn't actually mean tissue damage. So when we look at persistent pain, formerly known as chronic pain, what does that look like? Chronic pain and persistent pain is this heightened alarm system or this hypersensitivity to pain and movement into this risky environment. What that actually means is that the body has become overprotective and has increased the amount of space it wants before load is too much for damage. The best way that I can describe this analogy is the mountain analogy. As you can see here, I have two mountains, pre-injury and post-injury. Near the peak of the mountain, you have the tissue tolerance, or how much force any given tissue can withstand before an injury. In the first picture of the pre-injury, you can see that just a little bit below the tissue tolerance is you have your pain alarm system. And that's when you cross that threshold with enough force, that's when you're going to have pain coming on, warning you that, hey, any further and real damage will occur. Now, after an injury, your tissue tolerance does decrease because you're going through the healing processes and it's not as strong as it once was. But as you can see here, the pain alarm system is much, much further down because the body is being overprotective of this newly healed tissue that it doesn't want to cause damage there anymore. With persistent pain, so pain lasting 2 to 3 months or even longer, this becomes very hypersensitive. So we know with healing time that the body has healed, but why are we still getting pain? Oftentimes it's from people avoiding pushing into these pain barriers. Before we go any further, we should look at tissue healing time frames. So using the basketball analogy we were talking about, when you go up and you roll your ankle, the first 72 hours of injury is the inflammation phase. And during this time, the body's swelling, it's very painful, you can't really move the joint, and you have this increase of inflammation. This is very normal in the healing process and actually important to occur. Now, from 72 hours up to 14 to 21 days, you have what's called the repair phase. So your body's laying down new scar tissue, is trying to connect everything, heal the body up. Oftentimes it feels stiff, and you can still get a fair amount of pain during this time. After the repair phase, which is long, up to 21 days, it's the remodeling phase. And during the remodeling phase, it can last anywhere from a month up to 6 months, a year, even 2 years in some instances. Now, during this remodeling phase, it's actually really important to be pushing your body into these pain levels. You want to kind of do that because you're trying to increase the tolerance of the tissue again, and you're trying to diminish the alarm system. So going back to the mountain analogy where you have that alarm system starting on so early, you want to be bumping into this pain to kind of bridge the gap and shrink the alarm system so then you can get back to doing the activities and the loads that you were doing before. So what is the clinical application of understanding acute and persistent pain? Well, in acute pain, you really want to use pain as your guide and respect tissue healing times. If it's been 4 days after a bad ankle injury, you don't really want to be pushing into that 5, 6, 8 out of 10 pain because you could be at risk of injury. However, if you're at the 1 month, the 2 month, the 3 month, the 6 month mark, and you're still getting that pain, well, we have to look at it a bit differently. We're going to have to use a different rule. And what I like to do is I like to do the 4x4 rule. So I have to evaluate someone's irritability. If you're doing something and your pain is, say, a 1 out of 10, and then you go into an awkward movement and it shoots up to a 7 out of 10, but then you stop the movement and it goes back down within 30 seconds to your 1 out of 10, you're not very irritable. So you get the green light for me to follow the 4x4 rule. What that means is pain that's a 4 out of 10 that doesn't last longer than 4 hours is okay if you're beyond this initial 1 month of tissue healing. So we want to be pushing into that pain a little bit by bit, to kind of decrease the body's alarm system and tell the brain that, hey, we need to get used to having these forces on our body again so we can get back to the activities that we want to do. If you want to learn more about pain, leave a comment below. A huge shout out to Neil Pearson, Roland Fletcher, and the AMP for all the different lecture slides and courses that I've taken. Thanks for watching.